jump into it today. Welcome to the Anatomy of Therapy. I'm Dr. John Cebulski, and today we are talking about prehab. There's rehab, there's prehab. That's really it in terms of musculoskeletal stuff. But what is your perspective on prehab? We have trainers who think about prehab, and we have some doctors who think about prehab. Doctors may think about it a little less. The good ones, if you're involved in kind of performance, definitely do. I think the better end of the trainers definitely focus a little bit more on prehab in terms of performance and just kind of think about their client's life and more than just a get them strong kind of way. I think there's some trainers that do prehab probably better than some doctors do some prehab. And I think there are some trainers that should stop calling what they're doing prehab. But today, let's kind of get into prehab. Let's talk about a little bit what we think, most people think prehab is. Let's start with that. So like you walk into any normal gym, Bobby, what do you think people are calling prehab these?
Maybe it's just more like a warm-up, right?
Yeah.
We don't usually know the idiosyncrasies of our own bodies,
True.
especially just general public. So maybe things that they read off of Google. I have a lot of people that just, ask me, well, Google says this, and how long does it take for this? And
Right.
so, yeah, probably a lot of self-diagnosing, and then just whatever's on their Instagram or whatever's on hand for a warm up to
For sure.
whatever, make the pain feel a little bit less when they go into the gym.
I see there's some foam rollers in the corner. Maybe I should just foam roll a little bit before I work out and run on the treadmill for 5 minutes or something, get the blood flowing. It's important to get blood flowing. I heard that at rest, 20% of the blood is flowing through our muscles after 5 minutes of warming up. We got about 80% of the blood flowing through our muscles, so that helps us be more robust and not injured, right? Just kind of a general warm up, and that's not wrong at all. But I don't know that it's going to prevent injury. Prehab talks about preventing an injury, and I think there is plenty of literature out there that discusses how difficult it really is to prevent injury. I know that plenty of people have implemented programs are like, look, last season we had all these back injuries. Preseason, off season, we're going to be doing a bunch of Superman extensions for the back, and we're going to see if that makes any kind of notable impact on our football team next fall. And by and large, I don't know if you've seen any. I've not really seen any good data that what it is you're going to do is definitely going to prevent injury. Have you?
Yeah, actually I have. There's a lot, most of it is group based though. And,
Okay.
and sometimes that's an issue. So,
Mm.
they have issues with groin strains during a season. And then there's a study that comes out that supports Copenhagen planks for the team,
Yeah.
decreasing overall groin strains for the next
Right.
season. There's like the FIFA 11 program for ACL prevention or injuries in general.
Right.
The FIFA warm-up system that they've come that's actually shown evidence to prevent, soccer-related injuries. These studies like quad to hamstring strength ratios,
Mm-hmm.
asymmetry studies, things like the, not the plank, but I'm just blanking on the term right now, where you basically fixate your lower legs on the table and you hang off
Oh, right.
off the table. I don't
Um,
know. If you're less than 160 seconds or whatever the study was, you're more likely to sustain an injury. If you can do more, you're X times less likely to be injured if you can do that. So there's a lot of that stuff, but
mm-hmm.
it's usually done on groups. And so what you can take away from that, I think, is general rules,
Mm.
general themes. But working with let's say you're just a private personal trainer or you're a performance coach and you have an individual in front of you, that's, a lot less. There's a dartboard in the room when you're in the dark. So
Mm.
there's a chance you can hit the dartboard, but
Yeah.
there's also a lot of chance that you don't hit it.
Sure.
So it's, once you have the individual in front of you, there's so many factors that go into an injury, a non-traumatic injury, that I think those things become less relevant, those general rules. But I do think
Mm-hmm.
they're still great, and I'm glad there's a lot of people that study them,
Right.
so we know things about forefoot strike decreasing, injuries for this population, or when to heel strike, and there's general rules, but the individual in front of you can change all of that. So
Yeah, if you don't have all of the, and I think we were talking about this before the show, the data that goes into each one of these rules, it's going to be very, in terms of a group, you can only take so many collective data points, because there are so many continuous data points, and then after that, they exponentially kind of move and further away from each other. If you're thinking about FIFA soccer players or something like that, height, width, blood pressure, their red blood cell count. Some of those things, hopefully their red blood cell count, if they're healthy, should be within a particular range, but as you go further and further off to the distance, the things that don't matter necessarily towards, let's just say, musculoskeletal injury during the game, you start to lose those factors. So in terms of the patient in front of you, you have to get, and that's what a good history, or if you're a trainer, a good consult does, getting their prior injuries, medications that they're on, just their day-to-day life, what they're missing and lacking. And you can gather as many data points as you can. And at some point, we've talked about this many times, you have to kind of make a leap. You have to be like, look, I cannot guarantee that this will never, your knee will never hurt again. But if you were to do these Copenhagen adductors every day, and you're able to do this for over 90 seconds, 3 minutes at a time, and be able to keep each side symmetrical, I bet you would give yourself a good chance at not injuring this knee again. But that's not exactly the conversation that happens in clinics and happens in gyms, right? We try to give a little bit more specific stuff. And I want to, what are some of the differences do you think between a doctor's and a trainer's, just kind of right offhand? Because I do think I'm kind of more on the trainer side on this. I think trainers are a little bit better at the prehab stuff, generally speaking, than doctors are at this time. That's where I'm at on this, I think. But what are kind of the, we were talking about the data points for a group or whatever. What do you think the different data points are for the trainers versus kind of the doctors? And I know you're gonna have to generalize, of course, but generally, what do you think trainers and doctors think it separates them to?
Well, I agree with
I just
you.
want to know what you have to say.
Yeah, yeah, it's tough. Again,
Yeah.
this is where I don't have a good answer.
Okay.
I do. I
That's
mean, I
fine.
just think that they have different perceptions of the person in front of them based on their training, their knowledge, their background, their biases, their skill sets, the tools that they can apply. If you don't have I don't really look at people from maybe a psychotherapy standpoint. I don't really have training in that area, nor do I look at them from like you said, cosmetic surgery standpoint, because I don't
Sure.
have any skills in that.
Obviously.
So I am definitely kept within my bubble of whatever is possible for me to even perceive, for one.
Sure.
And with trainers, they do. I mean, the difference between a big difference between a trainer and a clinician is that the clinician sees you when you're not in your element,
Mm.
and typically,
Yeah.
and the trainer sees you in your element,
Mm.
especially if you work for the team. There's so many times where I've given my patients the caveat that sometimes I won't know the answer till I see you in person. Like, it only becomes evident when I watch you do your sport.
Sure.
And there's been many times where I'm racking my brain, like, why is this guy's shoulder not getting better? And then finally they send me a clip, or I'm able to watch them do a snatch. And then I'm like, oh my God, okay, I wish I would have saw this on day one.
Yeah.
And that this is never going to get better because of the way that they do the snatch. And then it just gave me a whole new insight to things.
Mm-hmm.
So there is some big time value to being with the person,
Mm.
doing the things that they love to do, that is possibly going to cause them injury or is currently causing them injury.
Right.
And that makes them better at that. Sometimes they have a better eye for things like movement. Often
Yeah.
they have a better feel for what natural healthy movement looks like. A
Mm.
lot of clinicians are very Excel spreadsheet minded.
Right.
It doesn't
Algorithm.
turn all the way in 45 degrees, and so that's less than this one, so then you're going to do more IR. Meanwhile, you didn't watch them move, you didn't watch them jump if they're a triple jumper or whatever their thing is, and that disconnect can cause issues. And on the other side, trainers sometimes, they're just not able to, they don't understand maybe healing properties, healing times. They don't understand maybe the cascade of injury and how that works, and capacity versus load, and
Right.
that discrepancy gets trainers maybe in trouble sometimes. The literature that they're studying is about getting the person stronger or faster or bigger
Hmm.
or whatever, not necessarily preventing injury. That is not always everybody's goal. So
True. I mean, yeah, like okay, so I love that you were saying a second ago. I want to go back to what you were saying versus seeing people in their elements, or doctors kind of seeing people, in the clinic, maybe walk down the hall, do a squat in the office, touch their toes or lean back, overhead squat, perhaps, move a dowel or something. It's simple stuff in the office versus, seeing a WOD or seeing them take a jump shot, right? Whatever. Seeing them go blue line to blue line and back. You're like, oh, that's what's going on with the knees. But I'm thinking about it in terms of like a doctor's perspective, like what active tests versus what passive tests are you doing, and how are you connecting the two? So if you do see them pronating and their knee dive in as they walk down your hall, do you find that those same correlations on the table? Are they prone? Does it also look weird? Does it look like their foot won't pronate? That maybe it is pronated. That they does it look weird because they are internally rotated and there is no internal rotation? Sometimes those things can be very, very tricky to kind of discern. You're like, well, I saw him walking down the hall and the foot and knee definitely fell in. It's obvious. You look down here, he's got a flat foot and his medial knee hurts, but there is no internal, like there might be those disconnects that kind of trap us a little bit when we see the active versus the passive. Um, I don't know where I was going with that, but so like I think if you can make a positive connection between the active versus the passive test, you should be able to have a better insight into the human's body versus just watching them snatch. You also really have to know what a good snatch looks like, perhaps having snatched yourself, right? And this goes to the point um, that sometimes I get frustrated with, where people, well, I think it was on the Joe Rogan episode actually, where Pavel Tsatsouline was like, never go to a chiropractor who can't deadlift double his body weight. I was like, geez, Pavel, like, but but that sounds kind of insane because there are a lot of chiropractors who can't. God bless Dr. Katie Clare, but she can't. And that doesn't mean that she's a bad doctor either. I think she's a wonderful doctor. She knows quite a bit, but I know she's not double body weight deadlifting. You know what I mean? But what he is saying there is that if you're going to tell a person during their double weight body squat or a heavy deadlift, hey, these are your faults. And I'm not saying Katie couldn't pick apart, a big deadlift or anything like that, but you definitely do know more about a deadlift. That doesn't necessarily mean that you couldn't help somebody's back. Do you know what I mean? You would just have to find other relevant data points. Um, have you ever heard that argument? I want to know what you think
yeah,
on that one. Like the Pavel Tsatsouline, you need to. By the Katie, you're the best. I don't know why I made your.
I
Sorry.
secretly hope she can deadlift like
I bet.
350.
Watch, she can. Watch.
Her
She's like,
her husband is a power lifter, so
well, there
there's a
you go.
chance. There's a chance.
I mean, she could watch her next post is just her like double body weight deadlifting like 5 times for reps, and then she's
Yeah.
like, anatomy of therapy.
Yeah. No, I mean, I think I've made this argument before. I mean, let's use Dr. Katie Clare for example still,
Yeah.
because I mean, we were in the same school together. But
Right.
let's just say we were in the same classes together. We had the same mentorship together.
Sure.
She's my identical twin, actually.
Jeez.
Everything about us is the same,
Okay.
but except for one thing, which is she went into professional dance and I went into professional weightlifting.
Okay.
Okay. And if somebody comes into my office and she works down the hall for me and they're a dancer, I shouldn't see that patient. I should
Oh,
send her down the hall
there you go.
because it's not my clinical skill that will
Yeah.
make the difference in this We have the same clinical skills, but I don't have that that experience, that empirical like
Mm,
time with those type of people. She's just going to connect to them, relate to them, identify things that I can't identify, and on and on and on and on. So I've always kind of made that argument, like if there's somebody nearby that is a special, because we can't all have been pro dancers and pro hockey players and pro basketball players and pro weightlifters,
sure.
and most of the time you're not going to have some world class gymnastic coach, physical therapist next door. That's usually not going to happen. So you have to try to figure out these cases on your own.
Right.
But but if all things were equal, I'm saying it's got to go down the hall. It's got to go to that person. So the Pavel quote is 100% in my mind accurate. I mean,
Yeah.
he's generalizing, I think, to say like if you don't have if you have some super heavy obese, smoking a cigarette while you're in for the initial consult, and that person's telling you how you should make better life choices and have get your health together and try to
Right.
exercise. He's saying pick a different doctor. He's I don't think the
Yeah.
deadlift was supposed to be so literal, but I mean he
I
probably
know what you mean.
loves that exact lift. but
Of course.
but but yeah, I mean I completely actually admire that. But
Yeah.
sometimes there are people that transcend that issue who for whatever reason don't really have much of an athletic background, but that can become amazing clinicians regardless. Or you have people that coach a sport that is not even really the main sport that, I know I was a track and field guy. There's people that were like sprinters themselves, but they went on to become high level decathlon coaches or pole vault
Right.
coaches.
Yeah.
It was a little bit tangential to their main expertise area,
Right.
or it can be completely off, to become a football coach or something later on.
Right.
I think there are people that are very good at that can transcend that issue, but most people, that's a very positive thing. I think CrossFitters are a good one. They don't really like to go see people that don't know what the word CrossFit is, especially when
Sure.
it's more famous now, but 5-10 years ago, you just say, what is CrossFit? Like most CrossFitters would just want to walk out and find somebody that can understand what they want to do every day.
Right. It's not necessarily a niche doctor now that you know how to deal with CrossFitters or what Murph is or whatever, right? I think that's a great point as well. I was funny. I was thinking we're going to get back to prehab in 2 seconds, and I do think this actually does relate to prehab. So we're going to stay on the topic today. But I was thinking the other day about like football coaches. It was a football coach. I feel like Dr. Seuss now. But like John Elway is a fantastic GM, part owner, or whatever he is for the Broncos. You have to think that John Elway's experience of playing football is very different from a lot of people who have ever played. There's a Hall of Fame quarterback who's been good he's made passes and he's played in games and played season after season, players after players, coaches and different offensive lines and different receivers. And he's gone to like his experience of the NFL is wildly unique in and of itself. He's had an experience of the NFL, his career, where now he can turn that around and reflect and manage the Broncos in a way and kind of turn them around in the last couple of years that his experience has uniquely kind of made him amazing for. But at the same time, there are GMs and owners of football teams that are successful for totally other reasons. But I do think that, specifically your experience kind of makes you unique, whether it's, a Hall of Fame quarterback career or, your skateboarding injuries when you were in high school. Like, I think if you rely on someone else's experience outside of your own, you're kind of cheating yourself by not giving that to the patients. Anyways, to the prehab, your experience kind of will help kind of determine what sort of prehab you start to give to certain people, right? So I think, if from a trainer's or doctor's standpoint, if you've had certain injuries, let's talk about that experience. You don't have to have deadlifted double body weight like I'm sure Katie Claire can. But if, say, you've twisted your ankle or you've busted up your elbow, you've got a little, kink in your neck when you wake up, even those experiences are helpful in giving prehab. I want to quickly go into the prehab that you give, especially in relation to doctors' injuries or trainers' injuries, and where I think prehab kind of began. And I totally imagined and hallucinated all of this. And as it turns out, I think it doesn't actually make a difference in terms of for what Bobby says, but he's wrong. But I think prehab started this way. The two perspectives on prehab are doctors who have seen an injury process finish or a healing process heal, and they go, from here on out, if you want to keep your rotator cuff healthy, you should do this exercise, and this exercise. I think that's where prehab started, right? To not allow an injury to happen again. Then this patient goes into a gym and starts doing his rotator cuff rehab, external rotation, the I's, Y's, and T's, stuff like that. And the trainer goes, hey, what's going on? Patient goes, well, I hurt my shoulder and I'm doing this so my shoulder doesn't injure again. And the trainer goes, oh, that's a great idea to think about exercises. What exercises should we do to help you not get injured, right? And so the doctor's perspective is, this is how your healing process will continue to go on, versus a trainer saying, these are exercises or drills or stretches you do to not get injured. And I think those are fundamentally different, but we may disagree here a little bit. But I think that's exactly kind of where the idea of prehab started, from doctors being like, you need to do this. But I think other people have said, no, it's not necessarily about a healing process. It's about stopping injury. And I think that you get some problems when you think about stopping an injury. Where are we not connecting here? Because I know that there's some part where we're not related on these points.
I mean, you could be completely right about the origin of prehab. I have no issue with that. Maybe it came from the doctors,
Kind of made that up
when they let people go, and sure, or it came from some sports and stuff like that. Who knows? But yeah, I think there are some fundamental differences. I think my point was, overall, there's probably some answer that the patient needs.
That's right.
And I don't really care if it's from a doctor's perspective or a trainer. Like,
sure.
Doctor and trainer are words that don't mean anything to me. There's an answer for the patient.
Andrew's being a point. It's just
There's an answer for
mouth sounds.
Well, no, I think he's hyperbolic when he says that stuff.
I know, sorry,
but
but
squat
okay.
is a real thing.
Yeah.
When you say squat, now I know what you're talking about. We have reference.
But doctor and trainer.
Yeah.
In this equation, doctor and trainer.
There are some differences, because
of
if you've sustained a severe disc injury, for example,
yeah,
that's very different. Preventing, further degradation, or maybe the prehab that's post, disc injury, like you were discussing with the doctor's perspective, is different than never sustaining a severe disc injury to begin with. Or, there's like some research that shows, there's no difference in bracing or taping to prevent ankle injuries for the first time. But once you've sustained a severe ankle injury, after that, there is evidence to support bracing and taping pre-game. So that's like a concrete example of where an intervention does matter, whether it's been injured before or not. But as far as the word trainer and doctor, to me, doesn't matter. Like, you would if you still knew all the information on both sides, if the trainer knew the doctor's info and the doctor knew the trainer's info, to me, I don't see a difference between what should be given to the patient.
Fair.
Now, there's difference. There's different things. There's different ways you can train the glute. Yeah. And nobody will ever have a right way to train the glute. Like, it's just whatever you think is best for this patient and this, in their sport. And
experientially, yeah.
Yeah. But I mean, there's what I kind of believe is that there is a real answer. The closest answer you have is just whoever gets to it is just the right answer. I could care less what their initials are.
Right. No, I agree. In the formula of giving a person an exercise, drill, intervention that will prevent them from being injured again, the doctor or trainer or YouTube video, honestly, it doesn't really matter who is the giver of that information. The ultimate goal is to get the person to not be injured again, or give them the best opportunity with the given information to, again, to see. And that's the other thing too, is the
Otherwise, otherwise it's just a biased perspective. So if you're a trainer trying to prevent ACL tears,
yeah,
well, you do depth drops and you do hops and you do glute strengthening and you check valgus and you check ankles
right,
and Q angles if you really know that much stuff, right? If you're a chiropractor, you might say it's because of your hips and the torsion at your pelvis and because of your low back. And if you're a PT, it's always your glute strength issue. And if you're a podiatrist, it's because of pes planus. It's going to promote more of this valgus moment when you hit the ground. And
right,
and if you're a doctor, it's just, hey, you probably shouldn't do this sport anymore. If you
yeah.
take glucosamine,
Stop.
chondroitin, and MSM, and yeah, switch
Aquatic
sports.
aerobics
It
is
just,
probably the
like
only
you
thing
see,
you
your
can do.
bias just gets puked out like on the person. But that's why I
Right.
mean there's a right answer, like floating in the ether or floating in the universe. But where you just try to, you're always trying to grab that answer. But many people can only see whatever is in their purview. You know what I mean?
I agree that the idea of there being a right answer out there is a thing, and that's what people are, when a doctor or a trainer gives somebody a thing, they think that's the right answer for, and this is the problem, I think, what they think the question is. So I'm going to give you an answer for whatever question I think is the main question, right? That will generate what answer I start to go for. So I think the underlying question or problem, I guess you could put those together, yes, will be, is the question is, how do I stop an injury, or is the question, how do I stay healthy? And I think those are different questions that could resolve in similar answers, correct or incorrect. But I do think you can get some different answers from different questions. And I know that that's not disputable, but the dispute, I guess, would be, if the question is, how do I stay healed? How do I stay feeling good? Versus how do I not get injured, would produce different solutions.
I don't think so. Not
Okay, that's
not
fair.
unless your question, not unless the question is not, unless the question is too broad or they're not the same. Otherwise, it's in
Well,
the
that's what I'm
form
saying.
of the question.
Those
The
are two
question is the
questions.
problem in my
Right.
mind. Then
Yeah. So there are two questions. The question is, how do I not get injured? And then there's a prehab solution. Or how do I stay healed? And then there's a prehab solution. How do those answers and solutions can overlap? But I think the what can I do to stay healed gives you a larger array of possible answers. Where how do I not get injured? How do I stay not injured? Has a smaller cadre of solutions.
I only think that that's possible because if you've been injured once, you're more likely to get injured again. So your problem is more difficult. But
Yeah,
to
that's a good
me, I
point.
still I still would think that there's a solution. And
Yes.
it doesn't matter if it's post injury or preventing one, they're still going to have the individual in front of you that you have to figure out. And
Yeah.
and I think if there's no injury, I think it's harder because you don't
Mm,
know where it could come from.
okay, that's what I
So,
would. Yep.
but that's
There
the
you go.
general body. But if you narrow the question down,
Yeah.
you still won't have any more information, whether it's post injury or pre. Because if they say, how do I prevent my right shoulder from getting injured in overhead
Yeah.
movements? your your skills are still the same. Well, okay, well, let me look at how your shoulder moves and your T-spine moves, and let me check your strength, and let's check your endurance, and let's look at
Hmm.
your skill level on this and your ability, your technique to do the movement, and that should be the same on both ends. I think the
Right.
problem is that we have initials after our name, and
Yeah.
that gives us a certain, what we should all be, we're like the billionth person to talk about this topic, which is bridging the gap. This idea of training is rehab and rehab is training, and
It's
I
not that
fully,
well known though. People talk about it, but it's
yeah,
really isn't. I know, just because the people that we surround ourselves with. But
yeah,
sorry,
yeah,
go
yeah,
ahead.
yeah.
Yeah.
Yeah, I mean, even though Charlie's like a quite popular name, it's still probably people don't know who Charlie Weingroff is most of the time, even in
Well,
our
yeah,
field.
true.
So that's true. That's true. That's true.
But sorry, but
But
go on with assume that we're only talking to the people that we know. But keep I like because I liked it what you were saying. So
yeah, I
uh,
think I think that there really shouldn't
bridging the
be a
gap.
different. Yeah,
Yeah.
there's only a difference because of liability, to be honest. If you're
Yeah.
if you've only read Super Training by Mel and all those guys, and you know how to get somebody super strong, but rehabbing them after they break is not, you've never studied it, you have to get them
Yep.
to the right person because liability reasons, blah blah blah. But if you really just wanted to be the best, I guess, at taking care of the person in front of you,
Right.
you should just be just sticking your hand out in all directions for information from all fields, you know, uh, to take, to learn everything you can if it so interests you, to be that type of person. I'm not
Sure.
saying that everybody needs to be career first and never see your kids again and just study study every field that could
No.
possibly
Yeah.
influence your patient. But I mean, you should probably take some lifting or weightlifting or strength training courses or seminars, or read a book on that, or read about evolutionary history, or go back and read some, human physiology and anatomy books again. A lot of times there's these courses that you and I have taken where the trainer can come and the doctor can come, and in
Yeah.
my mind, I don't really see much of a difference in the great questions that are being asked at those things. Sometimes you
True.
see the perspective they're coming from. The trainer's thinking about the application to the sport, and the
Yep.
clinician is thinking about trying to get them out of pain. But I see the same, I see the same
Process.
processing
Yeah.
going on, yeah, about trying to figure out how they can use this tool for their job. And I think, the better we become at integrating these different disciplines, the better. The
Yeah.
only time I like specialization is when it's life or death. If it's a glioblastoma, like I prefer to be surgically handled by the person who only does glioblastomas. You know what I
Sure.
mean?
Yeah.
I would like a specialist in that regard, but we're just not all. You're not always going to have that for I have knee pain. Okay, so we
Right.
have a knee specialist. Well, what does that mean? Well, then this knee guy's a runner. Okay, well, he looks at knees from running angles. He maybe doesn't understand because your knee hurts when you do Olympic lifting, so he doesn't understand that.
Yeah.
So there's too much nuance to treat the general public. So what you do is you just try to understand, I think, as many systems as you can, whether it's,
Right.
and I wrote down some notes, like one of the things doctors don't do well is think about other systems like cardiovascular ability, their ability to tolerate a certain amount of volume. We've talked about this before, like volume and load and their stress levels and cardio levels, all their ability to tolerate stress. And I don't just mean cortisol work stress. I mean stress of load and gravity and their training and their sleep and all this stuff.
Yeah.
So I think the better we can integrate disciplines and understand different systems, the better you'll do with your patient.
Yeah. No, I fully agree. The integration of other systems, or like I know we've talked about him a couple times before. We'll get him on the show, but Zach Couples in his like human movement matrix thing, he kind of has his big hitters. Like, I'll just be, are you sleeping? How is your sleep? Is it good? Is it bad? Let's make sure. Yes, I want to fix your TMJ issue and your shoulder issue, but let me make sure you're sleeping, eating right. A lot of these baseline things, a lot of times, let's just say PTs and doctors might even skip over, but your general MD, some maybe they skip over too. I don't really know if they're like, how are you sleeping? Are you eating not fast food 3 times a day? Questions like that they can kind of knock out. And like, look, it's kind of the low hanging fruit. If you try to over specialize and fix, it's not a glioblastoma, but you're trying to fix their red blood cell count and get it right to the upper end. And really, it just needs to be in a general area, and you're just trying to fix that red blood cell count. You're missing a whole bunch when they could just drink some more water. If most of my patients could get 3 or 4 nights of a good night's sleep, continuously, I mean, 50% of their problem just vanishes. I mean, that's probably 80% of my patients. If you could literally just sleep well for a couple nights in a row, put your phone down a couple hours. It's not one good night, it's a couple good nights in a row, and just really dude, that would take care of so many problems.
Mm.
But then you have to hyper focus down on, rolling their quad out and flexibility through their hamstring and hip. Because if you juice up someone's flexibility in their hamstring and hip, their knee and their back start to feel better. But you really have to amp that up more so than someone's sleep and someone's nutrition, versus if you get the low hanging apples. So I would say, as a clinician or a trainer thinking about prehab, what are the low hanging fruits? What are the common denominators that you can make sure are clear? You can make sure they're Copenhagen adductor, and those FIFA 11 stuff like that. They have met the baseline minimum of those standards. That would be the minimum you could do on prehab. After that, I think it's more appropriate to go, hey, Bobby, I really need you to put your phone down before bed so you can get some really good sleep, or niche down to their exercise and be like, look, I need you to do this single arm tricep extension with overpronation and wrist flexion to help your lateral epicondylitis. Those two could be the same person, but they're very different things. Make sure you get those low hanging fruits. Is that fair? Can we land on that?
No, I think that's a super good point that people should take away. And just to simplify it even further, I mean, just there's so many things that can be helped by just changing very simple things, right? Like
Right.
their health could be, back to the Pareto rule again, their health could be just so much better if they just fixed a little bit of their issue, if they just ate a little bit differently, if they just
Yeah.
slept a little bit differently. One of the things for, this low hanging fruit is just like, what are you doing all day long?
Mm.
Okay, you sit at a chair, you sit at your computer, which is understandable because you work, but then you come home and you sit and eat, and then you watch, 2 or 3 episodes of whatever's popular right now, Schitt's Creek or whatever's out there.
Watch it.
And never seen that, but
Me neither.
um
So many awards, though.
and then they say, I get headaches every day. And then you sleep with this, gigantic memory foam pillow underneath your head, and you sleep on your back with your head held forward by a pillow all day, and snore all night. And then you stick your head towards your screen, and then you stick your head towards your other screen, and then your other screen. And then you ride your gas powered chair to work. And, and, and then you come tell me you have headaches. And what I could do is I could take 15 different views of x-rays and tell you that your atlas is slightly rotated one direction and elevated on one side. You also have some degeneration at C5, C6, like every other human on earth. And then I'll tell you that you have headaches. And really, you could just say, hey, could you just try getting in different positions throughout the day than what you have been doing for the past 10 years? Like, I need you to go for a walk. I need you, when you sit there and look at your phone and swipe for 5 hours, that every 20 minutes you roll onto your belly and extend your neck, and then you can flip back onto your back and flex your neck again. Let's just change your position a little bit. You know what I mean? It's like, stop, this idea of stop walking on mall floors and go walk on the trail, and feel some undulations and perturbations and just some variability in your life. And a lot of those nagging, definitely modern pains can go away.
Yeah. Dude, I love that. That was one of my favorite rants that you've ever done. Um, I was thinking about it as you were saying that, being on your phone from one screen to the next. Great rant. What if a data point that you collected as a doctor was screen time? I said, pull up your phone, open up, how much screen time have you had this week so far? Or day to day, whatever it is. And so I checked your external rotation, it was 75 degrees. And I checked your screen time this week, and it was, 3 hours a day. And you also have this levator trigger point on your upper left shoulder, between your neck and your shoulder, probably, right? Just kind of, it's just in there somewhere, right? What if next week we check your arm's external rotation, and maybe it's 80 degrees, but we check your screen time and it's 2 hours. It's 1 hour, it's down an hour, or it's up an hour. What correlation would we see between that screen time and your pain versus your external rotation and your pain. Because a lot of times I would bet that external rotation, maybe it changes a little bit with their stretches and exercises, but like the direct connection to why they're in your office, they've got this trigger point in their upper scapular, the neck turns and it pinches, it just gets sticky. I bet you could find a better correlation to the amount of screen time they had. That's what that rant taught me, and I love it.
Absolutely. Like, how many times have you had somebody come into your office and say they feel worse on rest days, people that train,
Yeah.
or they feel worse, on the weekend? They feel worse when they're not at work. They feel worse when some people are the opposite, they feel better when they rest.
Yeah.
But there's a lot of people that, they hate rest days because their body feels worse. They need to go for that
Mhm.
10K run. Otherwise they get headaches and trigger points in their levator.
For sure.
And, I think, I've talked in recency, and it's something I've privately been holding on for quite a while. This idea of, you know, I study a lot of the evolutionary stuff going back in time, and like what we did most of the time was just a lot of low grade movement, a lot, and none of it was necessarily redundant. Like, you maybe had to go fetch water from a stream, but it wasn't, you know, put the pins at the right height, put the bar on your back, step back 1 foot, lock your feet in, squeeze your glutes, squeeze your abs, squat down perfectly and come back up. Do it
Right.
5 billion times for the next 10 years. You know
Uh-huh.
what I mean? Like, there was always something different and there was always movement to be had. And then you rested when you needed to conserve energy or conserve calories. That's fine. But
Sure.
this constantly varied movement, which CrossFit, kind of stole that term, trying to say constantly varied movement. And
Yeah.
to be fair, they've done a great job. But I mean, that isn't still, those are still patterns that those guys develop.
Sure.
They don't do any frontal plane stuff. They don't
Right.
twist hardly at all. So I
Yeah.
mean, there's things, but it's still great. It's still a great thing. So yeah, I mean, any way that you can, if you look at let's just say we don't know anything about that person besides they have shoulder pain, but all we did, instead of measuring their the things that we learned in school, all we did was try to see how mismatched they are from what that
Mm.
human species should be doing. And we just look at how
Mm.
much screen time they have, how much time they sleep,
Right.
how far they walk every day, how many steps they have, how many times they sit, how long they sit in a squat for, how long that they stand and bend over to pick things up or pick berries or whatever they're doing, right?
Right.
What if we look at the differences on that mismatch? And I would say it goes right back to your point that you just made. I think we would often see a better connection to how
Mhm.
close you are to doing those things and how well your shoulder moves or how it feels versus, you know, did you do these sets and reps that I studied that are supposed to strengthen the rotator cuff? Unless of course there's obvious dysfunction that they can't move their arm or trauma,
Of course. Yeah, but those are a very obvious connection. And I think sometimes with those BS screen involved, let's say they're more screen dominant, pain oriented conditions that a lot of us see these days, uh, are well more connected to those screen oriented times than they are versus orthopedic obvious times. Like, of course, if there are, someone has frozen shoulder, you're gonna notice orthopedic issues. Like, of course, that's not what we're saying at all. But there are people where there's just like it's kind of hurts sometimes, and it's at the end of the day. But sometimes it's like that
Mm-hmm.
sort of thing where it's not quite obvious in connection to the orthopedic tests, because then they move their neck. You see their cervical range of motion is okay. It's not bad. It's not good. It's just not, their condition is not as connected to the orthopedic test as it is to their cultural and societal developments that seem to be mismatched from those orthopedic norms. Is that a good?
Yeah, yeah, absolutely.
Okay,
Yeah, I
dude.
mean, yeah,
Yeah.
that's good. I think
Um.
sometimes, yeah, we tear things and we follow. We gotta look what the science says on repair time
Yeah.
and
Of
what the
course.
research says on how to train and how many reps and things like that. Going back to your prehab idea, especially
Yeah.
prehab, if you say, "Well, I just want to keep this person healthy," well, I don't know if it has to do with like, hooking up a band and doing external rotation, rotator cuff exercises. Maybe it's just try to use your arm in space like it kind of is meant to be used for. And if you're always just keeping them at your side or holding a phone or and then one day you know have to help your buddy put, you know, or help somebody on the plane throw a bag into the overhead, and your shoulder hurts, like just don't really be all that surprised that it hurts.
Right. Of
It-
course.
you know, so
Dude, I want to go back. We'll finish on this with prehab in terms of there are these specific exercises like thoracic rotation or clamshells or foam rolling, kind of these smaller level interventions in terms of prehab. And they're fine. That's not the prehab I'm talking about. I want to go back to, as part of your rant, the idea that CrossFit is prehab. Now, no one really says that directly, that CrossFit is prehab, or say like running is prehab, or doing ab exercises is prehab for your back. But there are kind of these general notions that, like, my neighbor Steve is like, I do my abs every time I work out 3 times a week, and yet sometimes my back still hurts. Or I do CrossFit 3, 4, 5 times a week, and yet I still have knee pain. I thought CrossFit was supposed to help me, it's functional training. It's supposed to help my friend move. But yet I helped my friend move. We were carrying a couch and now my back hurts. Like, so the distinction, let's go exactly with the CrossFit one. CrossFit is great. Bobby said CrossFit is great and it is wonderful in a lot of ways, but it doesn't guarantee that you will be injury free forever. CrossFit does, in terms of data points, really juice up some overall strength, some cardiovascular strength. Uh, these straightforward lifts, like the squatting, like it will make muscles and joints definitely more robust, generally more robust. Not necessarily specifically for lifting up a couch. And specifically, one of the things I see that CrossFit is really good at making you cardiovascularly and let's say VO2 max muscular output robust. You can go ham for 9.5 minutes, and you do, and you're on the floor sweating and dying after 9.5 minutes. But what that often does in terms of injury and prehab is that now that you are weakened from doing, one of those lady names exercises is escaping me at this point, but is that you are exposing yourself. You are incredibly weakened state, such that you did CrossFit 3 days in a row now, and you're walking like you rode a horse and you just drove cattle across Idaho. You're not walking well in your life. You can do the hell out of a CrossFit workout, but you walk into your local grocery store like your knees don't bend. Do you know what I mean? Or your back
mhm.
doesn't move. And that's where it puts you at a risk for injury. CrossFit itself is great in itself, but I think the wearing down part is where the prehab part starts to fail. Is that fair?
I just have one point.
Yeah, yeah.
I would add that if, and this is hard to quantify, so you just have to take my theoretical phrasing as fact. Let's just say we have somebody who has everything works great.
Yeah.
Well, then I think CrossFit, not CrossFit alone, it's not sufficient, but CrossFit does become prehab at that point,
Sure.
because if you have great everything, then your lifting, your running, your burpees, all these things, if done, with correct volume and technique and good coaching and nutrition and sleep and all these things, right? It actually is prehab. I mean, it's like
Yeah,
you're
absolutely.
using your joints, you're using your muscles, your heart strength, your lung capacity, all these things are doing great. So, but it's only prehab at the point that you have the capacity to do all those things.
Yeah,
If you don't,
good
then
point.
I think you're actually slowly degrading some things, even though you will be accelerating some things. So you might be improving your VO2 max and your lung capacity and even your heart health or something, or your lipid panels getting better,
Sure.
but your meniscus is shearing off. So
Yeah, good point.
because you don't have a hip or an ankle, or you have
Right.
torsion in your knee, or whatever it is. So if you don't have the full capacity, in some aspect, you're going to be degrading by doing CrossFit. But if you do have it, for the most part, it is prehab. You're going to be
Yeah.
building more robust tissues. You're going to be able to last longer. Maybe, that's why, if you look at somebody like Fraser or Rich Froning, or if you look at some of these 80-year-old CrossFitters that look so great when they're doing it, well,
Right.
chances are they have the prerequisites to do CrossFit throughout most of their life. That's why they can
Yeah.
still do it. If they can't do it, it's not because CrossFit's bad. It's probably because they didn't have the prerequisites, and then they trained CrossFit, and it broke them down.
Right.
And So, and again, CrossFit is also, I mean, training as hard as you possibly, I mean, Spina said this, if you're training as hard as you possibly can for 60 minutes once, or, once a day, or even 5 times a week or something, is not really still what we were doing historically. We
Right.
were, we weren't just sitting around and then going hard as we could for 1 hour.
Yeah.
So, yeah.
The formula of like, hey, I've been sitting down for 6 hours. I have to go make up for that by redlining my cardio, my lung capacity, and my muscular and my joint capacity. It is not really as judicious as, like you were kind of, I think you said in the beginning, I forget the exact phrase, but like mild variable movements kind of continuously throughout the day. You think about
Mhm.
working at a farm or something like that, you're just kind of generally moving from sun up to sunset, maybe with a variably increasing, undulating, I will learn that word today, solar flares in Iceland undulate. I don't know if you guys knew that. Some years are more than others. Hopefully, you guys can get out there to go see them soon. Check out Iceland and with a view. A hell of a vacation travel site. Is that what it's called?
Sure.
Okay,
All
cool.
things
Iceland
Iceland
with a view.
planning.
Jeannie, your wife is super smart, dude. Let's finish this up. Prehab is the best. You should do with your experience the best that you can do. It would be good if you learn some of these baselines. Make sure you kind of know the low hanging fruit. Uh, Whether the low hanging fruit be a Copenhagen. I cannot say Copenhagen today. Adductor, for 60 seconds or whatever they might be for you. If you're just doing your low hanging fruit is 90 degrees of external and internal rotation. Make sure you know what your baseline is and that you can kind of hit that each time. And going above or below that is how you're going to kind of specify things for patients. But I think wherever your experience is, that's where you need to live it. Anytime you start to reach above or below, I think that's where you kind of get out of your safety zone. I think that's the best place to thrive and the best place to finish. Bobby, anything else?
No, I mean, I would say regress to the point of the person in front of you. So, you know, like
I
for
like
example,
that.
they say
That's good.
barefoot running is good for you.
Yeah.
Well, not if you've been in Hoka's your whole life and you don't have feet
Yeah.
that can tolerate anything. Then it's a terrible idea to switch to barefoot running shoes or something like that.
Right.
So whoever the person is in front of you, just regress them to the steps that they can make progress. Like whether it's just getting them, to walk barefoot a little bit around their house, and then whatever you can do to build a progression, the body can adapt. And that's what it's so good at, is you give it the
Yeah.
right amount of stress, and it can adapt. And often we throw way too much stress at it or not enough.
Yeah.
So it's finding the right stress to throw at it and progressing it over time. And I think planning more long term than short term. So
Let me finish on this then. I do think that the right amount of stress to get the desired goal over a period of time, like that's a great formula, honestly, if you want to figure out how to make people change. And if you can start to master that formula. Brooklyn tattoo artist is how I want to finish this. I was watching this documentary on a very famous Brooklyn tattoo artist, who's one of the last few living from like whenever Brooklyn was going crazy in the 70s, 80s, and 90s. He's been tattooing this whole time. It was next to this, like, these very famous bars and concert halls. And after concerts and stuff, people would go over to his place to get tattoos. And he talked about his tattoos in a way where he was just like, everybody who saw this guy, his name totally escapes me right now, but everybody who saw this guy was an experience every time you saw him. You sat down, he talked about what sort of a tattoo you want, what sort of style you wanted, et cetera, et cetera. And then he would do it. And it would be about 30 or 45 minutes because he wanted to get in as many people as he could from these clubs that were right next to him, very famous places in Brooklyn. And so he was trying to pack as much of an experience that was unique to that person. If you think about a tattoo, however cheesy it is, like that's an expression of that person. And he was trying to develop an experience around giving that person their expression through that tattoo, right? Um, and he was also talking about how he wants to make his tattoos last for 10 or 15 years. So he's like, I had to change the style of my tattoos to make the lines a little bit thicker, make the color a little bit darker in certain areas, because I wanted these tattoos to last 10 or 15 years. I wanted these people to keep coming back to me year after year. And so this was, 2020. And he's like, I've been tattooing grandpas. I've been tattooing grandchildren. Like, I've got a whole generation of people, because the work I do is I want my work to last for 10 years. And so I thought about this and I was like, man, I get patients who come in and they go, okay, my back feels good. How long does this last? And I get that question and I would kind of dance around it. I'd be like, well, it's hard to predict future injuries, but from this Brooklyn tattoo guy's perspective, I almost wanted to go back to the beginning and be like, what sort of work, how thick would these lines have to be? What sort of rehab would I have to give these people to make sure that their back was better 10 years from now? If that was just my thought experiment, like we were talking about questions and answers, whatever question you're asking, you're getting that, you're going to produce some sort of solution for that. And if I'm just trying to fix this person's back today and make them feel better today, that's a very short-term thing. And sometimes you can come up with some solutions, like whatever you come up with, to make them feel better today. And you can do that. But what if you were like, I want my patients to feel better in 10 years. Now, maybe you don't achieve that, but like I'm saying, the question that gets your mind to that place where it gets you to consider the type of prehab, the type of stretches you give your patient, the questions you ask and the way you set things up to make them have their back be better in 10 years. Like, I think that's the kind of question I would like to ask for my prehab. Go get a tattoo from this dude in Brooklyn. They're pretty badass. But I'd like to finish on that. You got anything with that? Awesome.
No, I was just thinking good luck with anybody young, but otherwise,
Dude, I know.
great goal.
I know.
I just wish everybody, I didn't think about that either. Like, our mortality or our injuries or, it's more, sometimes it's aesthetics or power or to be the strongest person. Right. Those are the priorities, the sport. So, and that's okay. Sometimes, honestly, if you want to burn the candle from both ends and you're okay, kind of being, quadriplegic when you're 50, then whatever. Like, that's, I still don't think, I think that's fine, but it's not health. It's not longevity. It's not, and it's just too bad that everything hindsight is always 2020. And we wish we could go back and avoid those injuries, or maybe not lift so heavy, or maybe not, get so drunk and fall off that ladder, and what I mean, whatever it is.
That night, though, it was fun.
Yeah, I can't believe you did that.
It was wild, and my shoulder will never not be dislocated after that night. But I would say, it's just the guy said this is what he said. What separated him from other Brooklyn tattoo artists. And, he has a certain style, but that style came out because he was like, I want this tattoo to be badass in 10 years. I want it to last. And he's like, that's the distinction that separated me from all these other classic tattoo artists in Brooklyn. That's why I'm still here. That's why I'm successful. He's one of the best known tattoo artists. He's like, that was the one thing that distinguished me. And I started to think about it. I don't really know how to fulfill that with my patients right now, but it's a awesome perception and experience of life that I wouldn't have got. Thanks, Vice TV. And thank you guys for listening. Rate and review us. Give us 5 stars on iTunes. Tell your friends. If you got something out of this, share it with somebody, would you? Tell your friends to come listen to us. We're going to start a Patreon. Come join us on Patreon. We hope y'all enjoyed it today. Later.